Hello, my name's Simone, and this is my dad, Dr. Sabas.
Hi.
We've been thinking of doing something a bit different from our usual topics. It's typically a discourse on philosophy, but we're now thinking a bit more of an introduction on something that all of you might know as psychiatry. Um, I want to study medicine when I'm older and I want to specialize in psychiatry, and my dad here happens to be a psychiatrist. And I'm hoping he'll answer some questions for me.
Okay. Thank you. Okay.
Well, to start off, can you tell us from your perspective what exactly psychiatry is?
Okay. So first of all, again, thank you, Simone, for choosing to ask me these questions. And I hope this will be useful to you as well as maybe some other people who are listening to our blogs. Okay. Yes. Psychiatry is a medical discipline. Okay, as you know. Here, one has to first become a doctor and then do specialization in psychiatry for another 3 to 5 years, depending upon the country that you are doing your specialization from. And if you are still more adventurous, curious, or interested, you still can do sub-specialization in certain areas, like say forensic psychiatry or child psychiatry, or you can do old age psychiatry, and so many sort of other branches in psychiatry are there. So essentially, a psychiatrist is a medical doctor, as I told you, who has specialized in mental health, its diagnosis, and its treatments. By Psychiatrists differ from clinical psychologists who also do the same thing. They diagnose, they also treat mental illnesses to an extent, but they cannot prescribe. Okay, by the virtue of the training, psychiatrists are allowed to prescribe medications uh, and and give a treatment which is based on multidisciplinary approach.
In my school, I've been taking this one lesson, health and social care. One thing we do learn about is allied health professionals and the
Uh-huh.
whole thing with tertiary and secondary care. Like, how exactly do psychiatrists and psychologists fall on the sort of spectrum of, where they help people along the line?
If I understood the question correctly, I mean, there are a few things you said, maybe a bit mixed up. Secondary care, primary care are different. Primary care, we call general practitioners who work in the community and some other services. Secondary care, where people require slightly more specialized care, that's available in certain clinics somewhere. And tertiary care is when people need admission, okay, and they look at their rehabilitation needs. All right. So that's the framework. Currently, I'm working in secondary care, also sometimes in tertiary care as well. All right, I give my service. Talking about where clinical psychology, other people fall in that rubric. As I mentioned, psychiatry, we follow a model called biopsychosocial model. In fact, we can discuss about it in another day in much more detail. But that is one of the very prevalent and very what do you call uh, important models in psychiatry, in which psychiatric illnesses are conceptualized not only from a psychiatry or psychological foundation. It also acknowledges that there are biological concomitants, underpinnings to illnesses, also social, including spiritual components for the causation as well as for the treatment of psychiatric illnesses. So that's what we call as multiple disciplines. Doctors, psychologists, social workers, nurses, occupational therapists, so many people who work towards understanding the illness as well as treating the illness. I hope that makes sense.
Yeah, in my classes we have something called PIES, which is basically physical, intellectual, emotional, and social, which I imagine is similar
Yep.
to that three.
Yeah, something like that. Yeah, mnemonics possibly.
Yeah. Um. So, I've heard a bit about this thing called the DSM-5, I think. What exactly is it? Because I always hear it referenced whenever psychiatry comes into the picture.
Yep, yep. I'm glad that you asked that question. It's a um, it's like it's like a classification of mental illnesses. Remember that classifications, because there are so many mental illnesses. So somebody has to classify them, which belongs where. So there are two major classificatory systems in the world. Internationally, people follow something known as ICD, International Classification of Diseases. Now the 11th edition is just being published. All right, that's the latest one. And DSM is called Diagnostic and Statistical Manual. In the 5th edition is the American sort of invention, and they are the ones who also typically do the same diagnosis, but they are a bit more they're different in certain subtle ways, but more or less something which is diagnosed according to ICD should also be diagnosed according to DSM. Okay, there are lots of overlaps between these two subsystems, but ideally, yes, here in the UK, where I'm practicing currently, we follow ICD 10. ICD 10, I'm currently, obviously, as I told you, they're following the ICD 11 will be followed. It has not been implemented yet.
I know that.
So in fact, sorry, I have to interject again. DSM is called as the Bible of psychiatry, of the classificatory system, because of its prevalence and its use in, say, from medical legal purposes to so many other purposes that has been used.
It's pretty much like a guidebook, isn't it?
Set up.
Well, not really a guidebook.
Well, not guide, yeah, more for classifications, and also it gives at length lots of illnesses are described in the original volumes of the DSM in detail, how they came to the diagnosis and how the diagnosis was conceptualized, all those things. So different editions, as I told you, have come, and currently on the label on the DSM-5 in that edition.
So I get that it might be a bit different in this country, considering how you studied in India. But how would exactly, or what would you consider are the steps to becoming a psychiatrist?
Okay, I'm just trying to understand. There are two questions you asked there. So I did my basic training from India. Okay, like MBBS. I did MD. I also did a diploma in psychological medicine and diploma in psychiatry. Okay, so that is a system that we followed. Obviously, we studied on the ICD 10 as well as DSM. Right, those are the basic sort of what you call classificatory system. The time I sort of studied, that doesn't differ in a great way from psychiatry that is being practiced elsewhere. Obviously, every country has its own modus operandi. All right, they follow their own systems. So here they follow a system in which people are like registered in psychiatric sort of they enter into the psychiatric registration system. I'm talking about those who want to become a psychiatrist. They call residency system, and they sort of pass different levels of residency, and after that they have to do some years of, after passing the residency, under supervision they practice until they qualify as full-fledged psychiatrist. All right.
Well, another question, getting a bit personal here, but
Sure.
what exactly made you decide that you wanted to pursue psychiatry specifically?
Yeah, I mean, I have been asked this question many a time. Thanks for asking it. Well, I mean, there are many reasons. One it's a personal reason. Maybe one reason was that my mother had also some sort of a diagnosis of major depressive disorder. That sort of piqued my interest in psychiatry. And from my medical school days, my friends knew that, oh, well, Subhash will one day become a psychiatrist. He's slightly bit different than other persons. So it is a sort of a personal preference, I must say. The ability that I thought, well, I'll be able to read the psyche of people, and I would be able to use my knowledge in philosophy to an extent. I thought psychiatry is a perfect branch where possibly you can use your psychological, philosophical knowledge and practice it at the same time.
I remember one of your colleagues once commented that you'd have to be a bit crazy to understand people who Um,
Who did what? Sorry,
a bit crazy to understand people who have mental
mentally,
disorders.
yeah. That's a common myth, possibly. Yeah, many people sort of tell it as a joke, and unfortunately, that goes into people's sort of psyche,
Prejudice.
which should not be there. It's same as telling that, okay, to be a surgeon, you must have some surgical problems. To be a gynecologist, yes, you must have a gynecological problem, even if he's a male gynecologist. So that is it's bit of a what do you call set up a common prejudices against the subject. No, you don't have to be crazy to be a psychiatrist, but at the same time, interesting point is that those who took psychiatry have become psychiatrists, their mood disorders particularly slightly higher amongst them than general population. All right, but the cause you do not know.
Well, then, now that we're on the topic of misconceptions, I tend to hear a lot in media about like how psychiatrists are represented wrong. Like, I've heard a lot about how they're mysterious and hard to connect with, which I think seems kind of adversary to their whole thing about connecting with people.
Yeah, that's a good question. I might ask you. I have been your dad since you were born, obviously, and then since that time, have you found me like different or anyway compared to other people that you meet, am I, might have my own prejudices, I might have my own plus points, isn't it? I believe that is a media constructions. Again, people who they don't understand something, they become fearful. Okay, that might to an extent hold good for ghost or god, whatever you tell that. Okay, I'm not going to that dubious area again, but the point I wanted to make is that uh, yes, media often has a negative stereotype of psychiatry, thanks to movies like one Flew Over Cuckoo's Nest and the other movies, Rain Man, for example. They very often give a stereotypical picture of a psychiatric patient, because in the past we didn't have treatments available for these conditions. Psychopharmacology has been there for last 50 60 years maybe. All right, all this development have come since then. Before that, most of the treatment consisted of returning psychiatric patients, putting them in the asylum. Okay, so I can understand people's prejudices, but now things have made tremendous progress. Psychiatry is one of the rapidly progressive branches. Amount of research that is done in psychiatry is mind-boggling. All right, so it's important that talks like this will help to sort of dispel some of the myths about psychiatry.
Well, do you have any interesting occurrences you've come across when working in the field?
Yeah, probably I'll start with my marriage. Should I? Well, I have talked to my wife in the past. When married, she had some. I have talked to her obviously afterwards. She didn't tell me before marriage that she had some sort of fear that psychiatrists probably read the minds, so they can know everything about a person without talking. But then I assured her that no, that's not the case. And probably psychiatrists know about the mind as much as you know about my mind. So it is, we psychiatrists use certain tools to decipher some systematic ways they look how to describe, understand human behavior and how to treat it. All right, if it is abnormal, obviously, sometimes we might discuss it in a bit more detail, normalcy and abnormalcy. So that's one of the interesting features, as you said, personal example I could I could get. And every day, as I say, I come across people having different experiences that might look bit humorous had it not been so serious.
Well, I always thought that as a psychiatrist, you probably would have had at least some level of understanding of how people work. Like, I don't know, someone having road rage might be a bit more understandable after a bit. Well,
Yeah, yeah, if you want me to talk about that, yes, we have studied, as I said, multiple branches of, say, that lead to psychiatric practice. sociology, psychology, bit of social anthropology, okay, different subjects. So by doing that, the whole aim is that psychiatrist should be leading a multidisciplinary team, so that although I'm not a master of those subjects, I should have a working knowledge in those subjects. So that helps me to understand some behavior. Road rage is possibly one, that okay, the theories behind it. So why somebody engages more in road rage compared to other people, okay? Whether people having psychiatric illnesses are more prone, okay? So those sort of issues are there. But as I told you, that is not my specialty. I'm not an expert in that area.
So let's say someone's really interested by this topic. What pieces of media would you recommend them to read a bit further into? Any books or anything?
Yeah, I hope you don't say media. Obviously, you don't have to read media. I mean, the major sources would be, there are many good books available on psychiatry. I mean, many colleges of psychiatry have their websites dedicated for people who are interested in it. I can tell more about two colleges that I have been through. One is Australian College, Royal Australian College of Psychiatry in Australia, as well as in the UK, MRC. They've got a huge library of information available, including videos, audios on the subject. So it's important that people should go through credible sources than just going through media or through Google only. Wikipedia is another good source. Initially, people might have some sort of doubts about it, but it gives a good understanding about psychiatry, different branches of it. So those are the sort of ways they can do that. And they're really seriously interested, they might also talk to a practicing psychiatrist. They will be very happy to share their experiences. That's in fact part of our job, to dispel myth about the subject.
I mean, for a rather misrepresented field of study, I think it's pretty important to understand it through the eyes of someone who is a practitioner in it. Well,
Yeah, obviously, so that will be, if they could afford time, why not? I mean, they will be happy to help.
all right. I think that may wrap up everything we've.
Oh, okay, that's really good. First of all, thank you for showing your interest in the subject. I hope I misspelled some of those doubts about psychiatry and how people, those who are interested, can study more about it or know more about it before they think of taking it as a career. And in fact, one of our goals is to talk about a psychiatry related subject, psychology related subject, on a weekly basis. So you are all welcome to give your comments, questions. Hopefully, we'll be able to answer it through the blog sites. All right. So thank you, and until you see you again next week, have a nice time.
See ya.